The topic of posture is really important and really popular today, in my opinion at least. I get the question all the time, what's good posture? And it's just as important as topics like obesity, cardiovascular disease, how to prevent things like type 2 diabetes. What I would like to talk about now, though, is how good posture relates to lifting loads in the gym. Lately in the media, there's been a lot of emphasis on increasing activity, which I'm very thankful for, because activity is going to help people stay healthy, move better, and hopefully increase longevity as well as independence of living. When we think about our posture, one of the immediate images are one of someone sitting in front of a computer screen or a desk looking down. And I'm guilty of it too. Everyone does this. However, it's important to find the variance in your posture. Bringing your life from down here, and I try to remind myself to bring my cell phone up here sometimes, or adapt my screen so that it is in front of my eyes rather than my head being down all the time. So the weight of your head pulling forward causes the muscles at the back of the neck or your posterior chain to tension as we are resisting this downward force and keeping our head upright. So over time, you can see how that creates a lot of pain and tension behind the neck, upper traps. Alleviating that tension by bringing screens up in front of your face, in front of our eye level. And that takes off a ton of pressure from back here. Imagine how many hours we're spending here and why we have neck pain. What's going on with our posture when we enter a gym or a fitness center to exercise? Because that posture can be impacting how well you lift that load and over time, if this is going to lead to injury or not. I have a number of clients that I work with who are in restricted postures. And especially with my older clients around 65, 75 years, depending on their health history and depending on what they've done activity-wise, sometimes these postures are really restricted. What I prefer to work on first is opening up mobility before giving certain exercises or loads. The reason is the tissue's not ready. I'll give you an example. Let's take your typical forward head posture, forward shoulder posture. Okay, and we want to lift a load in the gym. We'll use this 10-pound weight over here. And I'm gonna go sideways. Hopefully you'll see this difference. If I lift this load here, so my head's forward, okay? If I lift this load up to the side in this posture versus lifting the load up to the side in this posture, I feel very different muscles working. Now, your eye may not be keen enough to see what that difference was. That's okay. But this posture and this posture require different muscle fibers and sometimes of the same muscles to work. If you've ever taken physics, you'll understand that the line of pull along a muscle follows the length of the fiber. As we change our postures, the fibers that we use to move a joint or joints can change and will change because it's just physics. So if we're going into the gym with improper postures and we're using certain forces through the joints of fibers that maybe weren't designed to move that joint that way, the line of force around the joint based on the fiber alignment will change, which can change how the system, so let's talk about the upper body, the entire system of the upper body is working. This can be detrimental because of the impact it has on your joints and the potential wear and tear that can occur. Over time, this can lead to things like a tendinopathy, inflammation of the tendon, bursitis, very painful inflammation of the bursa. We can also get a tear of the labrum, of the muscle, of the tendon itself. So this can all impact us over time, maybe not right away, but over years. And so for some people right away, again, depending on what their health history has been. So changing our posture, especially while we're lifting a load, can optimize which muscles we are using and how we are using those muscles. There are a few key things I'd like to address now when it comes to going into the gym and lifting a load that has to do with what's going on with your tissue. Are you warming up properly? Sometimes if we're in a tight position, a warm-up, which is intended to increase blood circulation and get our energy systems going, as well as improve overall mobility, can be helpful to allow you to get into the postures that you need to get into prior to working out. So walking into a gym, making sure you're doing a good warm-up will be essential. Second, take the time to roll out. Get a foam rolling tool or a ball, and you can roll out on some of these tender areas. It doesn't have to be painful, but you will feel some discomfort. It should be tolerable. That could be your upper traps, between the shoulder blades, along the pecs, maybe on biceps, triceps, or behind the shoulder. Finding the key points for you to roll out, you may notice, increases your mobility right away and can help change your posture. Now, I understand that sometimes there has been ongoing pain, for example, in the shoulder or the neck, something that has been long-term and not gone away. And this can restrict people from getting into the gym or doing fitness and exercise classes. Sometimes it's the exercise class that you're choosing that might not be optimal, or maybe it's how you're choosing to do the movements, and you might just need a little bit more education on that. One of the things that I love to do is movement analysis and helping people understand how they're moving, and based on what they want to accomplish, what the best mode of movement is. So if you are one of those people that has been having long-term pain, please consider seeing a health practitioner or movement professional who can help you.